Hello, my name is Karen Sanders, owner and founder of the RN Patient Advocacy NC PLLC company and also the Holistic RN Patient Advocacy Training Institute. Today, I would like to talk to you about every nurse's worst nightmare, short staffing. Let's talk about that. There are many factors involved with short staffing that affects different nurses, and I'd like to just talk to you about that. So first of all, short staffing is a nightmarish situation that happens to every nurse when we walk onto a nursing unit at the beginning of a shift and we have found out that one or two nurse colleagues have called in sick and that we have to share the burden of taking care of all the patients that they would be assigned to. So it would be almost twice the size of a normal assignment. So we are trained as nurses in nursing school to give high quality nursing care in a healing manner, and when we're not able to do that, it causes us great stress and distress. Let's talk a little bit about the underpinning of what we do. We are required to practice as nurses according to basic provisions of our own personal state Nurse Practice Act. We're held accountable by the American Nurse Association Code of Ethics. We're also held accountable by Patient Bill of Rights, by whatever facility we're working in. And also, we're held accountable to similar size, similar service standards of care for medical surgical nurses or nursing home nurses or critical care nurses. And another component of what's happening with short staffing is in the last 3 years, the literature has stated that medical errors are the third leading cause of death. That was before COVID. Now, COVID is now the leading cause of death in the United States, followed by heart disease, followed by cancer, and then medical errors. So now we know medical errors are a leading cause of death. We also know that medical errors occur, 80% of them happen at handoff. So that would be during shift change, giving a report. And it's not just nurse to nurse making errors. It would be pharmacists, physicians, hospitalists, laboratory staff, dietitians, housekeepers, and many other folks who work 24/7 in a hospital. So we have the setting of making errors. Then there's the whole component of moral injury. Moral injury is a phenomenon that has been described in the literature by soldiers. And what happens is when we are faced with a very distressing situation, it causes us to be exhausted, we become more cynical, and we also have decreased productivity. And what the literature says that being in a situation where we have moral injury causes us to have a deep soul wound that pierces our identity and our morality and our relationship to society. And we get it when we're unable to provide high quality care and healing in a healthcare environment. It causes us to suffer and experience anguish because we cannot give the care that we need. So another factor about moral injury, it's like consistent, routine, incessant betrayals of care that cause us to have 1,000 little cuts. And over time, those 1,000 little cuts can cause us to become very disillusioned with our work environment. And after a while, nurses will not tolerate that and they will leave. Last thing I'd like to talk about is the perilous journey that nurses work in when it's short-staffed consistently and chronically. They make serious mistakes. Nurses make serious mistakes when they're very stressed out at home and they're stressed out at work. And what happens is those two factors come together and they make career-ending mistakes. So they might violate their Nurse Practice Act, they might violate their Bill of Rights for patients or Nursing Code of Ethics, and they have career-ending mistakes that cause them to lose their licenses. So in my work, working with our State Board of Nursing, we do a course called Ethical Legal Decision Making for nurses who make mistakes. And those nurses who've made mistakes go on to lose their jobs. They get reported by the Board of Nursing, then they lose their licenses, and then they're forbidden to work in the state as a certified nursing assistant. So I call them Phoenix nurses because they lose everything, and then they come back renewed and rejuvenated because they now understand the mistakes they made. There are different reasons why nurses make mistakes. They're overwhelmed, they're short staffing, they're not able to ask questions. Sometimes they don't question physician orders. Sometimes they don't ask help from supervisors. Sometimes there are narcotic issues involved, and sometimes they're not questioning their assignments. So in summary, it is really a good thing for nurses to try and take care of themselves by knowing their Nurse Practice Act, knowing the American Nurse Association Code of Ethics, knowing what are the standards of care in the community for other hospitals with similar size, similar service standards of care, and to take good care and ask questions when you don't know the answer. This is Karen Sanders. It is my pleasure to speak with you today.